What are the latest updates regarding organ donation in the United States? How variable is radiation dosage for non-invasive diagnostic coronary artery disease testing? Have hepatitis B vaccination rates for newborns changed since 2017? This and much more on today's JAMA Editor's Summary. Hello and welcome to our listeners all around the world. Today is Friday, February 27th, 2026. I'm JAMA Deputy Editor Dr. Linda Brubaker, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. Today I'm joined by JAMA Deputy Editor Dr. Preeti Malani. Hey Preeti, let's get started.
Hi, Linda. During the past couple of decades, there's been a marked growth worldwide in diagnostic testing for coronary artery disease. As you know, several of the commonly used imaging modalities for coronary artery disease expose patients to ionizing radiation. Dr. Einstein and colleagues examined radiation doses worldwide for patients undergoing non-invasive coronary artery disease diagnostic testing. They included data from 742 centers in 101 countries during a single week in 2023. The participants underwent testing with a wide variety of modalities. The study's primary outcomes were radiation effective dose. The authors reported that there was significant variability in radiation doses among imaging tests and among patients receiving the same tests across centers, regions, and country economic strata. They also found that current radiation doses for cardiac testing exceed the dose recommended by guidelines for 21% of patients undergoing nuclear cardiology studies and for 44% undergoing coronary computed tomography angiography. The results identify critical needs for training, standardized protocols, and updated equipment to reduce radiation exposure worldwide.
And clearly there are some opportunities to improve care, Preeti. Let's move on to some JAMA research letters. Dr. Rothman and colleagues contributed a research letter about hepatitis B vaccinations for newborns in the United States. Using electronic health records data from the Epic Cosmos database, the authors reported that hepatitis B vaccination rates rose from 67.5% in January 2017 to a peak of 83.5% in February 2023, then declined to 73.2% in August 2025.
In their research letter, Dr. Hussain and colleagues investigate changes in organ donation after circulatory death, when donor organs are recovered following irreversible loss of circulatory function. Technical innovations have increased interest in donation after circulatory death to address the shortage of donor organs. The authors report that donation after circulatory death in the U.S. rose from 118 in 2000, about 2% of all donors, to 8,129 in 2025, about 49% of all donors, using data from the Organ Procurement and Transplantation Network. This week's JAMA Perspectives is on a related topic. Dr. Alia Brubaker and colleagues contribute a perspective article that provides an overview of the evolution of deceased organ donation in the U.S. It describes the historical and legal frameworks that govern organ donation and explains how these policies have changed over time.
In their viewpoint, Dr. Gong and colleagues discuss a new model for supporting patients with chronic diseases like hypertension and diabetes. The authors discuss the Advancing Chronic Care with Effective, Scalable Solutions, or ACCESS model, which was recently announced by the Center for Medicare and Medicaid Services as a bold strategy to align reimbursement with clinically meaningful outcomes to improve population health. The Viewpoint by Drs. Kissinger and Smith reflects on the Make America Healthy Again strategy to remove unhealthy foods from the Supplemental Nutritional Assistance Program, commonly known as SNAP, taking note of arguments for and against state-level restrictions on SNAP.
In the JAMA Clinical Reviews and Education section, Dr. Drum and colleagues tackle a common conundrum in their Rational Clinical Examination article, Intravascular Volume Overload, With data from 40 studies, the authors discuss how to accurately assess intravascular volume in patients and what tests may be most useful in clinical practice. Be sure to check out the accompanying podcast in which JAMA Associate Editor Dr. David Semel discusses this topic with the article author, Dr. Lyles. Let's listen to a bit of that conversation.
So let's review the symptoms of volume overload.
Sure. And like I said, patient population is a big deal in what they're presenting with. And maybe the most common presenting symptom we found in our review was dyspnea, shortness of breath, difficulty breathing. Patients will also complain of difficulty sleeping, in particular recumbency, so orthopnea. And patients will talk about the pillows they use, the number of pillows, or even sleeping upright and recliner. They'll talk about swelling or edema, things not fitting anymore, and weight gain. And one thing in my practice I really come to rely on is if I can get in touch with a primary care physician or an end-stage renal patient, their dialysis center, and find out their dry weight or a baseline weight. But weight change or weight gain is a big symptom folks will complain about.
JAMA also has 2 clinical articles that focus on care for pregnant patients. The JAMA Insights article by Dr. Short and colleagues discusses HIV care during pregnancy and postnatally, including breastfeeding counseling for individuals with HIV. And the JAMA Insights article about heat and pregnancy by Dr. Kovatz and colleagues provides relevant information on methods to improve maternal health, especially with increased ambient heat sources like hot weather, high indoor temperatures, and occupational exposures.
And there are new guidelines from the American Society of Clinical Oncology about fertility preservation for people with cancer. Dr. Castillo and colleagues highlight the major recommendations for adults and pediatric patients, like disclosure of possible infertility prior to starting cancer treatment, and when to offer fertility preservation to patients. The latest JAMA patient page includes risk factors, signs, and symptoms of metabolic dysfunction-associated steatotic liver disease, or MASLD, which is the most common chronic liver disease worldwide, affecting 30 to 40% of the general population.
Clinicians will be interested in the latest JAMA+AI Conversations podcast. JAMA+AI Associate Editor Dr. Yulin Schwen discusses what safe clinical use of large language models requires in connection to the Do No Harm framework with Drs. Rodman and Wu. Here's a clip from their discussion.
We know that the humans usually bring down the performance of models. Even when the model improves them, the model by itself would be better. We know this from other fields as well, like autopilots and airplanes. So there's a well-described phenomenon of a performance paradox where high-performing AI systems will often improve humans, but not to the level of that system operating independently. And there is a paucity of evidence right now in medicine on how you actually improve the humans, not just for cognitive tasks like diagnosis or management, but also procedural tasks.
And as always, there's a lot happening in health news. The JAMA Medical News team has a summary podcast that publishes every Friday, which takes a deep dive into the latest in medical news. You can subscribe at JAMAmedicalnews.com or click on the link in this episode's show notes.
Thanks, Preeti, and thanks to all our listeners for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Linda Brubaker. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in this episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.